like to officially welcome you to the Value Institute Spring Symposium for the elimination of healthcare disparities. And we use the term eliminating, not reducing, eliminating.
We understand that from lots of very reliable data that some communities get less effective health care than others, and certainly less than we would like.
As a resident, I did my residency at Yale, and as a resident, I saw disparities in the hospital. I saw differences in the way people were being cared for.
We have disparities in men and women. We have disparities with age. But our biggest disparities is in socioeconomic groups with disadvantaged people.
We knew that in Baltimore we had a big problem with health disparities, and we had many years working on cardiovascular disease and on hypertension, so we decided we would focus on that problem.
As a nation, we spend 2.5 times the average of the industrialized nations and more than 50% of the next highest country. And unfortunately, we only have a life expectancy of that's about average of that group of industrialized nations. Health disparities and social determinants of poor health are primary cause of why we have that gap.
As a population across the United States, we can't afford to have two different standards of care for patients dependent upon their background.
It's really about personalizing the experience for every person that we serve. And the Value Institute and the work that happens at the Value Institute really is driving us towards achieving our goals as illustrated in the Christiana Care Way.
Taking a patient-centered approach is obviously critically important because one size fits all we know doesn't work.
My research and the infrastructure that we're building really focuses on not how do we address health disparities, not just in healthcare settings, but outside in communities.
Christiana Care has really invested not only dollars, but actual resources, man-hours, and a lot of thought in terms of thinking about how we can change our model of care so that we're not looking at an individual person as a patient when he or she arrives in the clinic, in the emergency room, or in the hospital, but instead part of an entire community.
The population health management is a new facet that really is going to give us different types of data. It's actually going to change our focus from not just managing patients who are sick and acutely ill, but really improving their health status so they never come into the hospital, so that they can manage themselves at home. And doing that in measurable ways that we know we're making a difference.
The Center for Organizational Excellence helps clinical and operational leaders identify projects along 4 broad dimensions: quality and safety, operational efficiency, cost reductions, as well as patient and provider satisfaction.
And I think it's inspiring to see that a health system is so engaged with its community and it's connecting its researchers and sort of big thinkers and bringing them all together to work on this problem.
I'd heard a little bit about the Value Institute in the past, but to really hear not only what they're doing, the fact that they're based within the healthcare system, and the opportunities and the close relationships, the private-public relationships, the fact that there's the infrastructure to do that and the relationships is really exciting.
The data sets and how we measure across continuum is getting really complicated. We have multiple data sources, we have different types of data that's coming in, and we can fool ourselves thinking we're making a difference when we're not. The expertise that the Value Institute brings is just enormously helpful and really will position us to make a difference, that we really know we are making that difference.
So in the Value Institute, you have an entity here that allows us to look at the programs. Every single thing we do with delivery of healthcare can actually be examined by engineers and researchers, mathematicians and statisticians to really see if we're getting the best bang for our buck in terms of what we're delivering, and to help us strategize about better ways then to deliver that care.
The Value Institute is what is intended to help us find ways to deliver care more effectively to our community. And if there are pockets in the community in which healthcare delivery is not adequate or as effective as we would like, we need to understand why, and we need to establish systems of care that will fix that problem.
This is a problem everywhere you go in the United States. It's critically important that we address it in Delaware, critically important we address it in the whole country.
To me, health is a human right. It's not a privilege. This is something that we all should enjoy. And there's a growing will to want to see that change.
Eliminating disparities is so important, not only from a social justice standpoint, but also from the point of improving the health of our entire population.